Come in.
Hello. Hi. How are you today?
Hi. Good.
Good. So my name is Giselle. I'm going to be your nurse practitioner for today.
Hi,
So
Giselle.
I'll be evaluating you for today, okay? So can you tell me why you're here?
Here for an annual physical, actually.
Oh, yeah? Okay.
It's been
Let
a
me
while.
just wash my hands real quick, okay?
Okay.
I'm going to wash it for 20 seconds. Make sure it's nice and clean before I start assessing you.
Very important.
Yeah. So you're here for a physical, huh?
Yep.
Okay, so we're going to start from head to toe.
All
So
right.
I'm going to ask you a few questions. Well, actually, I'm going to ask you a bunch of questions.
Uh-oh.
So we'll start with your mentation.
All right.
So can you tell me your full name?
My name's Eric Kayanen.
Okay, and can you tell me your date of birth?
My birthday is October 19th, 1990.
Okay, and where are you right now?
I'm in your clinic right now.
Okay, and can you tell me again why you're here?
I'm here for a full head-to-toe assessment.
Great. So the patient is alert and oriented times 4, and it seems like his speech is clear and coherent. And we're gonna exercise your memory, okay?
All right.
So what did you have for breakfast today?
I had a pastrami and rice sandwich.
That sounds really good.
Let's see.
So can you tell me who won the election this 2020?
Biden, baby.
Yeah, right?
All right.
Okay, great. So now I'm going to tell you 3 words, and I'm going to need you to remember them by the end of this exam, okay? I'm going to ask you the question at the end.
Okay.
Okay, so the words are yellow, green, and couch.
Yellow, green, and couch.
Okay, great. So let's start with checking your blood pressure.
Okay.
Check with your left arm first.
Okay.
Put this on right here.
Mm-hmm.
Very good. Now. Thank you. Very good. Okay. Very good. Your blood pressure is 126/84.
Okay.
Now we're going to do it on the other arm. Try to keep this here.
Okay.
Okay, and your right arm, it's 120/76.
All right.
There you go. Take this off of you. Alright, so now we're going to check your heart rate. Okay?
All right.
Can I borrow your arm, honey? Okay, great. I'm going to count for 15 seconds, okay? Multiply it by 4.
All right.
Very good. Your heart rate is 84 beats per minute. Put this on your chest. We're going to count your respirations. Alright, your respirations are 18. Everything is good. So now let's take a look at you. So I see that your head is normocephalic and intact. Your hair is evenly distributed. See your texture. Hair is smooth and fine. Your scalp has no scales, no mass, no lesions.
Mm-hmm.
Okay. Any tenderness? Tell
No.
me if it hurts.
No pain.
Okay, and there's no tenderness. All right. So I see your your face is symmetrical.
Mm-hmm.
I don't see any rashes, no redness, no swelling, no lesions, no scars.
Mm-hmm.
I'm gonna feel for your temporal artery. Okay.
Okay.
Tell me, does it hurt?
No.
No. Okay. Let me feel for your pulse. Okay, your temporal pulse is 2+ with no thrills. Okay, so I'm gonna look at your eyes. Let's see your eyes. Your eyes, your eyelids, and your eyebrows are symmetrical. Can you blink your eyes for me?
Mm-hmm.
Can you raise your eyebrows? Very good. So patient is able to blink and raise eyebrows voluntarily. So I see that your sclera is white, and your cornea is shiny, and your iris is brown.
Mm-hmm.
Okay, now can you look to the left and to the right for me? Very good. Your medial and lateral canthus is pink. Okay, your conjunctiva is pink, bulbar, and palpebral. All right. And I also see that your pupils are, let me check the pen light.
Okay.
Okay. Your pupils are round and midline. Now I'm going to check for a reaction of your pupils, okay? See that your pupils are around 4 millimeters brisk and reactive to light directly. Check your other eye, okay? About 4 millimeters brisk and reactive to light directly. So now we're going to check if it's consensually reactive to light, okay? So I'm going to shine the light on your left eye and the right pupil should constrict.
Okay.
Okay? Very good. Very good. So pupils are reactive to light consensually. Okay. Now I'm going to get the ophthalmoscope. I'm going to dial it to 0. Turn the light on. Oh, we're going to turn the light off. So we can see clearly. Okay. So I'm going to take a look at your right eye, okay? Okay, I see that red reflex is seen. I see the vessels are seen. Okay, I see that the fundus and the optic disc are seen. It's yellowish in color. I don't see any cupping, no bulging, no nicking of the AV. Okay, good. And turn the light back on.
Okay.
All right, I'm gonna check for your peripheral vision, okay? Tell me when you start seeing my fingers.
I see it.
Very good.
See it.
Very good.
See it.
Okay, very good.
Okay.
So now we're gonna check for your sinus, okay? You're gonna tell me if you feel any pain. Any pain?
No pain.
No. Any pain?
No pain.
Okay, very good. So frontal and sinus is non-tender. So now we're going to check your ears. I see that your ears are symmetrical. I don't see any rashes, lesions, any nodules, any redness. Okay, tell me if your helix is painful.
No.
Your lower lobe.
No.
Your tragus.
No.
Okay, so what I would do in the right ear, I would also do in the left ear. Now I'm going to grab my otoscope. I'm going to take a look in your ear, okay? So I'm going to grab on the, you can face this way, very good. I'm going to grab on the pinna and pull back and up and out. Oh, turn this on. Okay. So I see that your tympanic membrane is pearly gray, and I see some cerumen. The external canal is intact. I see the cone of light is at 7. I don't see any perforations, any bulging. I don't see any erythema, any swelling, any mass or lesions. Okay, great.
Okay.
All right. Oh, let's take a look at your nares actually. I'm just gonna change the cover. Okay, so let's take a look at your nares. I see your nose is symmetrical in its midline. Now I'm gonna take a look inside, okay?
Mm-hmm.
So I see that your nair has good hair distribution. I don't see any polyps. Pain and clear. No septal deviation. Your septum is pinkish in color. And I don't see any discharge. Okay, and what I would do on the right, I would do on the left.
Perfect.
Now I'm going to check out your lips. Okay, looks like your lips are, the contour is even. Pinkish in color. I don't see any bulging. No redness, no cracking, and no bleeding.
All right.
Okay. I'm going to take a look inside your mouth. I'm just going to grab my pen light.
Okay.
All right. So, can you open your mouth for me? Can you smile actually? Teeth are white. Open your mouth. Patient has all of his teeth. Okay, now let me see your tongue. Tongue is rough. I don't see any white patches, no lesions, and no fissures. Okay, good. Stick out your tongue and say ah. Very good. I see that the uvula is raised in midline. Your tonsils are pinkish. There's no swelling. There's no white exudates. Let me look at on the side of your mouth. Open your mouth. Open. Buccal mucosa is pink with no sores, and your gums are pink as well. And can you lift up your tongue actually? Okay, and your frenulum is intact. Your hard palate and your soft palate is pink as well.
Nice.
Okay, great. I'm gonna do your cranial nerve, okay?
Okay.
So you're gonna close your eyes, occlude one nostril, and you're gonna tell me what you're smelling.
Alcohol.
Very good. Now you're gonna do it in the other nostril.
Alcohol.
Very good. So your cranial nerve olfactory is intact. Now we're gonna do cranial nerve 2, which is the optic nerve. So I have this Snellen chart here. You're gonna stand up for me.
Okay.
So you're gonna normally see this. You're gonna see this 6 feet away. And you're gonna tell me what these letters are right here.
Okay. L-E.
And you're gonna cover one eye.
Oh, yes.
Yeah, one at a time.
Sorry.
It's
So
okay.
let me start.
Thank you.
So L-E-F-O-D-P-C-T.
Very good. Now you're gonna cover the other eye.
L-E-F-O-D-P-T-C.
Very good. Okay. So you have 20/20 vision from 6 feet away. You can have a seat now again.
Okay.
Very good. So cranial nerve 2 is intact. So cranial nerve 3, 4, and 6, which is the ocular motor, trochlear, and abducens. We're gonna check your gaze. Okay, you're gonna follow this green.
Okay.
Okay, just follow the pen just with your eyes. Very good. So I don't see any nystagmus. You have good six cardinal gaze, signs of gaze, and I don't see, you have normal convergence and accommodation. Now we're gonna do cranial nerve number 5, which is the trigeminal nerve. I'm gonna check for corneal reflex, okay? Very good, corneal reflex is intact. Now we're gonna check for the TMJ, which is the temporomandibular joint. You're gonna open and close for me. Very good. Okay, I didn't feel any clicking. Did you feel any pain when you did that?
No.
Okay, very good. Now you're gonna close your eyes for me and you're gonna tell me if you feel sharp or dull.
Okay. Dull. Dull. Sharp. Dull.
Very good. So cranial nerve 5 trigeminal is intact. Now you're gonna check the facial symmetry. Can you smile for me? Can you frown? Puff up your cheeks. Okay, very good. So cranial nerve 7 is facial is symmetrical and intact. Now we're gonna do cranial nerve 8, which is your vestibulocochlear, acoustic, and what was another one? With your hearing. Okay? So we're gonna do the Weber test. So I'm gonna bang this, and you're gonna hear. You're gonna tell me if you can hear it on both your ears. Okay?
I hear in both ears.
Very good. So there is no unilateralization. So your Weber test, you pass the Weber test. Now we're gonna check the Rhine test. So I'm gonna bang this again on my hand, and I'm gonna put it on your mastoid bone. You're gonna tell me when you can't hear it anymore.
All right.
And then next, I'm gonna put it right next to your ear, and you're gonna tell me when you can't hear it anymore.
Okay.
Okay?
Can you hear it? Can't hear it.
Very good. So your air conduction is greater than your bone conduction, which is very normal.
All right.
Okay. Next, I'm gonna do the whisper test.
Mm-hmm.
Okay, you're gonna include one ear, and I'm gonna whisper something to you and repeat it to me.
Apple.
Very good. Now cover the other ear.
Orange.
Okay, great. So your cranial nerve 8 is intact. Now I'm gonna test for your reflex. The cranial nerve 9 11 and 12, which is also includes the gag reflex,
Okay.
which is what I'm going to do as well. Let me get my pen light.
Okay.
Okay. Stick out your tongue and say ah. Very good. Now I'm going to try to gag you. Okay, good. Gag reflex is present. And I see that the palate elevates symmetrically.
Okay.
So cranial nerve 9, 10, and 12 is intact. Now I'm going to check cranial nerve 11, which is your spinal accessory. You're going to go against me. Okay, great. Shrug. Very good. Cranial nerve 11 is intact. Okay, so all your cranial nerves are good.
Good.
They're all working. Now I'm going to check out your neck. Okay, so I see that your neck is symmetrical. I don't see any nodules, no rash, no lesions, no bulging, and I see that your trachea is midline. Now I'm going to check for your thyroid. Okay? I also don't feel any nodules. Okay, can you swallow for me? Very good. Okay, so your thyroid rises evenly. I'm going to check for your carotid pulse. Very good. It's 2+ with no thrills.
Okay.
I'm going to listen to it for any bruise with the bell. Okay, no bruise. Now I'm gonna palpate for your lymph nodes, okay?
Okay.
You're gonna tell me if there's any pain. Preauricular,
No.
postauricular,
No.
tonsillar,
No.
occipital,
No.
superficial cervical chain,
No.
deep cervical chain,
No.
post cervical chain,
No.
submandibular,
No.
submental,
No.
supraclavicular.
No.
Okay, very good. So all your lymph nodes don't have any tenderness. Okay, so I'm gonna ask you to take off your shirt. We're gonna cover your front, and I need you to face this way.
Okay.
Okay, cover you up.
Thank you.
All right. So I see that your thoracic region has no rashes, no lesions, no bulging, no mass, and so I see that your neck curvature is concave, and the thoracic is convex, and your sacrum is concave. And I see that you have a normal curvature of your spine. So you're gonna tell me if you have any tenderness, okay?
Okay.
Tenderness?
No.
No?
No. No.
Okay, very good. Now I want you to say 99 for me.
99.
Say it again.
99. 99. 99.
Very, very good. No tactile, no consolidation and tactile fremitus. Okay, now take a deep breath. Very good. Exhale. Okay, so diaphragmatic expansion is symmetrical. Now we're just gonna percuss all over.
Good.
Okay, so tympani all throughout. I don't feel any hypo or hyperresonance. Now we're gonna check for diaphragmatic excursion, okay?
Okay.
So I want you to hold, take a deep breath and hold it. Okay. Okay, now feel dullness here. I'm gonna grab my pen and my measuring ruler. Right here. Now you can exhale, I'm sorry. Okay, now inhale and exhale and hold it. Exhale and hold, great. Okay, great. Right here. I'm gonna measure. Okay, it's about 5 centimeters, which is normal. Great. Now I'm gonna check for tenderness. Okay, tell me if it hurts.
No. No.
Very good. So there's no CVA tenderness. All right, I'm gonna listen to your lungs. Okay.
Okay.
Okay. Deep breath. Okay, lung sounds are clear in all lung lobes. Now I want you to say 99. I'm gonna change it to the bell.
Okay.
Okay, say 99 repeatedly for me.
99. 99. 99. 99. 99. 99. 99. 99.
Very good. Now I'm gonna want you to say E.
E. E. E. E. E. E. E. E.
Very good. Now I want you to whisper 1, 2, 3. Okay, so there's no consolidation in egophony, bronchophony, and whispered pectorally. Okay? So now we're gonna go in your front of your chest. Can you
Okay.
try it for me?
Mhm.
Very good. Now let's cover your back.
Good.
So I see that your chest, it has no rashes, no lesions, no bulging, no redness, and I see that your chest rises symmetrically and there's no accessory muscle use.
Mhm.
So I'm gonna listen to your hearts now. I'm gonna listen to your lungs. We're gonna do the same thing that we did in the back, but we're gonna do it in the front.
Okay.
We're gonna do it the same. Take a deep breath. Okay, lung sounds are clear. Now we're gonna do 99.
99, 99, 99, 99, 99, 99.
Okay, now we're gonna do E.
E, 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 E.
Very good. Now whisper 1, 2, 3.
1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3.
Okay, very good. So there's no consolidation in the anterior portion
Okay.
of your chest. Okay, so now we're gonna try. We're gonna listen to your heart sounds.
Okay.
Okay. We're gonna listen both with the bell and the diaphragm.
Okay.
So this is the aortic on the right second intercostal space,
Mm-hmm.
and the bell
Mm-hmm.
S1 and S2 auscultated. This is a pulmonic, which is the left second intercostal space
Mm-hmm.
with the bell.
Mm-hmm.
S1 and S2 is present. This is the Erb's point, which is the third left intercostal space.
Mm-hmm.
S1 and S2 present. There's no extra heart sounds. Now this is the mitral and the fourth intercostal space
Mm-hmm.
with the bell.
Mm-hmm.
S1 and S2 and no extra heart sounds.
Okay.
Now we're gonna do the mitral with the diaphragm. S1 and 2 is present with no extra heart sound. I'm gonna ask you to lean forward.
Okay.
Okay. The mitral with the bell has S1 and S2 and no extra heart sounds. Okay.
Okay.
So I'm gonna lay you down because I want to check your jugular venous pressure.
All right.
Okay, lay down for me.
Okay.
Yes. I'm gonna get my ruler.
Okay.
So we're gonna go by the sternal angle.
Mm-hmm.
Can you please turn your head to your left?
Okay.
Just your head. Thank you. Now I'm gonna see the pulsations in the most upper portion of your jugular vein, and I see right here. Sorry. Okay, it is at 3 centimeters. All right, thank you. Now I'm gonna palpate for your PMI. Okay, let's
Mhm.
see if I can palpate from here. I cannot. So I'm gonna ask you to lean to the left a little bit.
Okay.
Thank you. I'll try to palpate from this side. Okay. It's brisk and tapping, and it measures about 3 centimeters. Okay, great. You can lay down again on
Okay.
your back. Now I'm gonna check your abdomen. Okay.
Okay.
Okay, so I see that your abdomen is symmetrical, it's round. I see a little bit of striae here, and I see that you have a birthmark here,
Mm-hmm.
and another birthmark here.
Yeah.
Okay, but I don't see any redness, I don't see any bulging, no masses. Okay, so I'm gonna listen next.
All right.
Okay, so it's normal active in all four no four quadrants, okay, in your bowel sounds. So now I don't see any pulsations of your aorta.
Mm-hmm.
So now I'm gonna listen for bruits on your arteries, okay?
Okay.
With using my bell. Okay. Okay, aorta has no bruits. Renal artery has no bruits. Iliac artery has no bruits. femoral artery has no bruise. Now I'm gonna percuss. Okay, tympani all throughout. I'm gonna percuss for your spleen, okay? Okay, tympani, which means there's no splenomegaly. Now I'm gonna percuss for your liver.
Okay.
Liver span. Okay, I hear dullness there. Now I'm gonna start from the bottom. Okay, now I hear dullness there. I'm gonna measure. And it's about 6 centimeters, which is normal. Okay, great. So now I'm just going to do palpation.
Okay.
A light palpation. Tell me if there's any tenderness.
No tenderness. No tenderness. No. No. No.
No?
No.
Okay, very good.
No.
Now I'm going to do a deep one, okay?
Okay. No. 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 No.
Okay, now I'm going to try and palpate for your spleen. Can you take a deep breath for me? Okay, your spleen is non-palpable. That's good, which means there's no splenomegaly. Now I'm going to try and palpate for your liver. You're going to hold your breath. Inhale and hold your breath. Okay, liver edges are defined. I feel it. It's smooth. Okay, very good. Okay, sounds good. So now, and I don't see, there's no masses. I didn't feel any masses, no bulging, no tenderness, okay? Let me check for your inguinal. Any tenderness?
No.
Any tenderness?
No.
No, I didn't feel any bulging, any masses or tenderness there as well. So I want to check your upper extremities. You can just stay in this position.
Okay.
I'm going to check for your brachial artery.
Okay.
Okay, it's 2+ with no thrills. 2+ with no thrills. Let me check for your femoral popliteal. We're going to lift your leg here. 2+ with no thrills. Your post-tibial. 2+ with no thrills. And your dorsalis. 2+ with no thrills. And whatever I do on the right, I will also do on the left. Next, I'm going to auscultate for bruise with my bell.
Okay.
No bruise on the brachial. No bruise on the radial. No bruise on the popliteal. No bruise on the posterior tibial. And no bruise on the dorsal pedalis. And whatever I do on the right, I'm going to do on the left. Just going to check for tenderness, okay? Any tenderness?
Okay. No.
Tenderness?
No.
Any tenderness?
No.
Any tenderness
No.
here? Okay. So there's no tenderness in the MCP, PIP, DIP, in the elbows and the shoulders.
Okay.
Any tenderness on your knees?
No.
On your ankle?
No.
On your toes?
No.
No. No tenderness in the MTP, DIP, and PIP as well. Okay. So now we're going to do a range of motion.
Okay.
Okay? So lift, flex. Good flexion. Internally rotate. Good. Externally rotate. And then flex. Very good. Now push down like you're stepping on a pedal. Very good. Good plantar flexion. Now the opposite way. Very good. Dorsiflexion. Okay. Now invert. Very good. Evert. Very good. So now we're going to test your muscle strength, okay? Try to push down. Very good. Try to push up.
Okay.
Very good. Try to push down. Very good. Try to push up. Same here. Try to push up. Try to push down. Very good. So you have good muscle strength. I'm going to say 5 out of 5.
Okay.
And whatever I do on the right, I will do on the left.
Okay.
Okay? Do you mind standing up for me? Oh, you can put on your shirt.
Okay.
Okay, so bend down for me. Try to touch your toes. Very good. And then try to get up, stand straight, and hyperextend your back. Very good. So able to flex and hyperextend the spine. So now I want you to follow what I'm doing, okay?
Okay.
Shrug your shoulders. Very good. Now extend, flex. Internal internally rotate, externally rotate. Now flex your wrist down, flex your wrist up, spread your fingers out, close your fists, and do this. This is opposition. Now you do adduction, hug yourself, abduction, hands out. Great, beautiful. Now you're gonna raise your arms out with the palms up, palms down, supine and pronator. Now you're gonna do it fast. Very good, fast reflexes. Okay, great. So we're gonna do balance next.
Okay.
Okay? So stand right here and try to walk in a straight line from your heel to toe. Very good. Stop here. And when you go back the other way, I want you to do it on your tippy toes.
Okay.
Very good. And when you go back the other way, I want you to do it on the ball of your feet.
Okay.
Very good. So you have a good steady gait that I can see. So now we're going to check for Romberg side. Okay, I want you to close your eyes, hug yourself, and stay this way. We're going to count 15 seconds. Make sure you don't fall.
Okay.
Okay, 15 seconds has passed and I don't see any sway. Now I want you to keep your eyes closed and extend your arms facing up with your palms up and keep it that way.
Okay.
We're going to count for 15 seconds. Make sure that there is no pronator drift, which there isn't. Okay, you're all good, so no pronator drift.
Good.
Very good. Okay, so now you can have a seat. We're now going to check for some sensory. Very good. Okay, so I want you to touch the ball, touch your left shin with the ball of your right foot. Great. Slide down and do it the opposite way as well. Okay, now I want you to feel, you can keep your arms straight. Tell me, keep your eyes closed. Tell me if you feel this.
I feel it. Feel it. Feel it. Feel it.
Very good. So now I'm going to test you if you feel sharp or dull. Okay?
Dull. Sharp. Dull. Sharp.
Okay, great. Now we're going to test for vibrations. Tell me if you feel any vibrations.
I feel vibrations. I feel vibrations. Feel the vibrations. I feel vibrations.
Okay, very good. Okay, now I want you to open your hands, palms up. Keep your eyes closed. And you're going to tell me what I put in your hands, okay? What does it feel like it is?
Feels like a quarter.
Very good. And what about this one?
Key.
Okay, great. Yeah, very good. So there is no stereognosis. Now we're going to check for deep tendon reflexes, okay?
Okay.
All right, you can open your eyes now. Great. Stay in this position. We're going to bend this. We're going to check for the tricep reflex.
Okay.
Very good. Tricep reflex is intact. Now we're going to check for brachial. Very good. Brachial reflex is intact. Brachioradialis. Very good. Brachioradialis reflex is intact. Now I want you to sit in this chair. Okay. Patellar. Very good. This one. Okay. And we're also going to do the bicep. Okay, great. Bicep is intact. So now you need you to lay down with your tummy down. We're going to check for the reflex of your Achilles, okay?
Okay.
Very good. One more time. Very good. So Achilles is intact. Now we're going to check for Babinski. Okay, very good. So Babinski reflex is present. Now you can stand up. Very good. So now, do you remember the 3 words that I had told you earlier today?
I believe so, yes.
Okay, what is it?
It's a green yellow couch.
Beautiful. Okay, so that
That's it.
concludes your head to toe assessment.
Sweet.
You are good to go. So just let us know whenever you need to come back.
Awesome. Thank you. I'll see you next year.
All right, great.